Hello everyone. Today we'll be talking about first aid, work injuries, ergonomics, and legislation on occupational health and safety. So first, let's talk about first aid. So what is first aid? This is the medical attention that is given by a first aider that is usually administered immediately after the injury and at the location where it occurred. So most of the time, it consists of a one-time or a short-term treatment and requires little technology or training to administer. That's why we have yung mga BLS training or your basic life support training. And also, sa mga ambulance or yung mga with BLS na training, they also teach how to use the defibrillator. So ano yung defibrillator? That's the machine that sends electrical impulse yan, para ma-revive yung patient. In this slide, you can see that the first aid includes minor cuts, scrapes or scratches, minor burns, applying bandages and dressings, use of non-prescription medicine, draining of blisters, removing debris from the eyes, massage, and drinking fluids to relieve heat stress. In this slide, we will be talking about the OSHA's first aid kit requirements. So you have gauze pads with at least 4 by 4 inches, two large gauze pads, box adhesive bandages or band-aids, a gauze roller, two triangular bandages, wound cleaning agents such as sealed or moistened towelettes, scissors, blankets, tweezers, adhesive tape, latex gloves, resuscitation equipment, resuscitation bag or airway or a pocket mask would be an example. Two elastic wraps, splint, and directions for requesting emergency assistance. So this is usually a first aid manual. Next, we have your work injuries. So how do we classify our injuries? This is by cause, by modality, by location, and by activity. First, we have by cause. So, what caused the injury? So, it may either be intentional or accidental. So, for intentional injuries, examples of this are violence, war, or even self-harm. For accidental naman, we have your falls or your motor vehicular accidents. So next we have your bimodality. So you have your trauma, strain or sprain, toxins, and other external or internal injuries. The classification, location. So we have your skin, head, eyes, brain, nerves, soft tissue, musculoskeletal, organs, and body. So it is where you were injured, what part of your body. And lastly, by activity. So, during what activity did you have your injury? So, this could be sports, recreational, and occupational. Let's now go to the terms that we use. So, first we have your lacerations or cuts. So, these are wounds caused by a tear or a deep cut in the flesh or skin. It can be minor or major depending on the types of cut and severity. Next, we have your sprain and strain. So these are caused by stretches or tears in the ligaments and muscles, respectively. Next, we have your bruise. So it is an injury caused by an impact that damages soft tissues and underlying blood vessels. Next, we have your burn. So this is an injury that gives a feeling of discomfort caused by exposure to heat, flame, chemical agents, radiation, or even electricity. Now we move on to your emergency terms. So first we have your code blue. So this is when your patient's heart stop beating or his or her lungs stop functioning. Then we have your code red. So this signifies that a difficult or a dangerous situation has worsened severely so as to constitute an emergency. We now move on to ergonomics on occupational safety. So what is ergonomics? This is the process of designing or arranging furniture, products, or systems so that they fit the people that use them to minimize the risk of injury or harm as a result. Okay? So, ergonomics aim to create a comfortable, safe, and productive workspace by bringing together health and design with positioning and adjustment based on things such as your body size, the height, strength, skill, speed, and your sensory abilities, like your vision and your hearing. So when you speak of ergonomics, so it aims for you to become comfortable para hindi ka mahirapan. You don't get stiff neck or you're not nahihirapan your hands when you type sa keyboard. Yan. So in this slide, you have your ergonomic chair. Yeah, so you have your adjustable seat height. And so you adjust the height of your chair so that your knees are bent to a 90-degree angle when your feet are flat on the floor. Yan. So para hindi hanging yung ano mo, yung legs mo if you're kind of short. And so adjustable seat depth. You have your dense foam cushion. So para hindi matigas, hindi ka mangangalay while sitting down. You have your wheels and offers flexibility. Yung seat tilt functionality. So it allows you to move freely in your workspace and to kind of stretch a little bit. Yan. Since sitting down for long periods of time causes yung parang strain sa body natin, especially if we slouch or if naka-straight body ka and you're not used to it. So you have your armrest also. You have your 360-degree swivel. Yan, you can turn around. You have your firm lumbar support or the back of the chair. You have an adjustable backrest. You have also your adjustable headrest. So again, para dun sa neck mo and yung shoulders mo, it won't get that strained. So when you search for if you work in an office or even in the laboratory as medtechs, kasi we are now using computers, di ba? So when we type in for the results, we're using yung mga chairs. We're not standing up naman. So yung requirement natin or not even a requirement, but the recommended chair that we use is a ergonomic chair talaga. So here we have your viewing angle. So again, just like what we talked about, yung ergonomic furniture or ergonomic devices, they can also help with your senses. So for this case, it's your vision. So dapat daw yung eyes mo to your screen, dapat meron siyang 30-degree angle horizontally for it to be perfect para hindi ka mahirapan when you use it. Next naman, we have your keyboard and mouse. So your computer mouse should be comfortably within reach of the user. So wrist should be in a neutral position. Wrist or palm support are ideal. Keyboard should be slightly tilted and at a comfortable distance also. Now, for the last part, we talk about your legislations on occupational safety. So, what does the government do to enhance yung occupational safety ng mga Filipino citizens? So, first, you have your Republic Act 11058. your Occupational Safety and Health Standards Law. So this law requires employers to provide complete safe work procedures, to inform workers of hazards associated with their specific jobs, to provide appropriate and personal protective equipment which have passed the DOLA's required test, to provide access to mandatory trainings as prescribed by the DOLE also. So, yung mga employers mismo or yung mga bosses natin, yan, they are required to provide us with all of this information and all of this training. Next, we have your Presidential Decree 856 or the Code on Sanitation of the Philippines. So, why is it included for your occupational safety? So, it is included kasi dapat yung workspace natin, it's clean. Okay? Especially for those food establishments or even your hospitals, even schools. So, mostly, any establishment, dapat malinis yan kasi your environment affects your work. Yan, it affects the health of the people going there. Yan. So, dapat, syempre, hindi siya madumi. Now we have your Presidential Decree 442 or the Labor Code of the Philippines, the Occupational Safety and Health Standards. So the state shall assure the rights of workers to self-organization, collective bargaining, security of tenure, and just and humane conditions of work. In this presidential decree, the state shall afford protection to labor, promote full employment, ensure equal work opportunities regardless of sex, race, or creed, and regulate relations between workers and employers. So when there comes a time na magkaka-problem yung employee and the employer, we go to the Philippines department that is mainly focused here, which is your DOLE. Okay? So right now, if you can see sa social media, they have yung mga um, contacts na with the DOLE. You can straightly go there or even just send an email from your laptop or your phones. Yan, or send them a letter regarding your problem, and it is quickly being responded by the department. Bakit? So, let me talk about this. Kasi in the Philippines, we're a third world country and usually, yung mga employers natin, ang ginagawa nilang employees, they are minors or they don't give their proper benefits or yan, hindi sila nabibigyan ng proper salary. They're below the minimum wage or yan yung mga benefits natin like yung SSS, PhilHealth. So these are requirements by the DOLE for the employers to be given to their employees. Okay? So let's all thank the laws provided by the Philippines that these laws actually protect us from those kind of things. Yan. So, meron tayong department to run to when those things happen. And yun nga, meron tayong panghahawakan na law from the government, from the Constitution.